Hi, it's Jessica DaMassa with WTF Health. What's the future health? We are bringing you a special series where we are talking about how health innovation and technology is evolving to meet the needs of the COVID-19 pandemic, specifically helping out hospital systems. So joining me today, I have Akin Demehin. He is the Policy Director for the American Hospital Association for the AHA. So Akin, it's a pleasure to have you with us.
Thanks for having me. Really appreciate it.
Thanks. So I know the AHA is doing a number of things to advocate for hospitals and health systems. I mean, you guys have launched this 100 million mask initiative to talk about PPE and providing the front lines with those things that they need. You're curating resources, all sorts of guidelines and best practices as far as crisis management and ethical guidelines. And you're even pushing insurance companies in terms of quickening reimbursement and getting better reimbursement to support cash flow. But first, I want to talk about some of the things that are happening from the tech side of things for our audience here, who are really in the space of digital health, telehealth, remote monitoring, and are trying to get in touch with hospitals in terms of helping make sure that other people who are not infected with COVID-19 don't need to go there unless it's absolutely critical. So let us pick your brain, if you don't mind, about some of the things that you're hearing from hospitals as it relates to telehealth. I mean, so I guess give us a quick, your impression, your state of play on where some of these health systems are right now. How important is it for them to integrate in some of these remote monitoring and telehealth solutions? Is this top of mind for them, or are we inventing the fact that they're really interested in doing this right now?
Sure. Technology really is one of the integral solutions to addressing this unprecedented pandemic. And you talked a little bit about some of the work that we're doing at the AHA to make sure that folks on the front lines have the resources they need to fight this pandemic in terms of personal protective equipment, in terms of reimbursement to hospitals to shoulder the enormous costs of grappling with this pandemic. But one of the things we're also grappling with is, how do we extend our footprint in a way that gives patients access to care, but takes a little bit of the pressure off of hospital emergency departments and off of inpatient units? Telehealth absolutely is one of those critical tools that can be incredibly helpful. You can imagine that there is a patient at home who may not be acutely ill and need to come into the hospital, but is worried about what their condition is and wants to know more information. So being able to connect with a hospital, being able to connect with your provider using telehealth is one way to do that. That means that you don't have to set foot inside of a hospital to get some of the care that you need. And it has the benefit to hospitals of lessening some of the burden on the use of things like personal protective equipment. And as I'm sure you've heard, that equipment is in shortage in a number of places in this country. So really serving as an extender of hospital services, that is the critical role that telehealth can play here.
And so in terms of the ability for these health systems, I mean, and we've known this because of just how the industry has carried on over the last number of years. Some hospitals are further along with implementing a virtual care program than others. So, I mean, those who are maybe, just starting out, who might be looking at the federal funding that's coming through the FCC, they've got $200 million now to implement telehealth services and health systems and hospitals and physician practices. So from that perspective, from those who may not be as up to speed as some of the larger health systems who have more robust solutions, what are you hearing, or what are some of the concerns that maybe they have? I mean, are they just eager to implement whatever they can and they'll go back and fix it later, or are they still looking at this as part of the strategy to extend their care delivery, and they hope that whatever they put in place now is going to be the infrastructure of what's there in the future?
I think you bring up a really important point, and that is that hospitals are on a spectrum with respect to the extent of their telehealth programs going into this particular pandemic. I will say that CMS in particular has made some regulatory changes that are aimed at making it easier to deliver telehealth services and be reimbursed for those services. For example, They've relaxed some of the restrictions around originating site, some of the geographic limitations for delivering telehealth services. They've enabled the use of tools like Zoom, Skype, FaceTime, tools that are not ordinarily used to deliver telehealth services, really in an effort to make it easier for hospitals to implement. For those who are farther along on their telehealth implementation journeys, those flexibilities really help them double down on what they're already doing. And for those who are a little bit closer to the beginning of that journey, having a wider array of tools available to you, a slightly better reimbursement landscape, and fewer regulatory requirements helps them get started a little faster.
These regulations that you've mentioned, from your perspective at the AHA, talking to hospitals there, and the advocacy work that you guys do you expect some of these changes and regulations around telehealth to stick after the pandemic is over?
We certainly hope at least some of them do. We have advocated for a long time around some of the geographic restrictions and originating site requirements around telehealth services. That may be one regulatory area that is ripe for making permanent. I would say that once this pandemic has passed, there will be opportunity for all of us to evaluate which of those regulations that were relaxed make sense to continue to do into the future. And through that process of reflection and evaluation, I think we will identify some examples of regulation that may have been designed in a different era, and that we find that in mounting the response to this particular pandemic, relaxing or waiving those regulations makes a lot of sense, and it may make a lot of sense to do on a permanent basis.
Knowing what you know about hospitals, what do you think they're going to look at when they're in that period of reflection and evaluation after this is all over? I mean, what are some of the the KPIs they're going to be looking at in terms of yeah, this makes sense for us to do? Because I mean, as these things are implemented moving forward, I mean, the hospitals are going to have to kind of reevaluate their own delivery system. So it's like, what are the things that are going to matter to them, you think, when they're evaluating yes or no on keeping some of these regulations loosened, or redefining these regulations, or even some of their own hospital policies and procedures? What's going to matter?
Well, one of the things we know about this pandemic is that it is bringing significant volumes of sick patients into hospitals, and those that arrive at our doorsteps are usually the ones that need the most intensive services. But at the same time, we know that there are folks out there who have COVID, who may not have been diagnosed yet, but who were able to reach through telehealth. I think one of the things that will be evaluated in retrospect is just how many patients we were able to reach using those services. It is one indicator of the extent to which we've been able to extend our footprint into the community and meet needs in a different way.
I think too, I mean, I heard this great little soundbite by Brendan Carr, who's the commissioner of the FCC, and he was talking about the implementation of telehealth. And he was like, this is healthcare's movement from being a Blockbuster video store to being Netflix. And so there's a lot of, retooling and re-engineering that will ultimately, have to happen to support that moving forward. Do you think hospitals, after this immediate crisis is passed, we're trying to, think ahead in best case scenario. Do you think that this is going to be something that hospitals look toward increasingly, is how do they become more of a Netflix for healthcare as opposed to relying solely on the Blockbuster model of in-person care?
Sure. I mean, even before this pandemic, there were already hospital and health systems that were examining how they expanded their digital footprint and how they delivered services in ways that go beyond just the four walls of the hospital. We're really sort of, this is a test for the healthcare system in a lot of ways. It is testing some of these new delivery models like telehealth. And I think it is certainly an opportunity once the pandemic has passed to figure out what worked well and what we can make even better going forward.
All right, so talk to me about this 100 million mask challenge. I think this is a way, no matter who you are, in health tech, not in health tech, random citizen watching this is a way for us to get involved and support the front lines of healthcare and hospitals. So tell me a little bit about it.
Absolutely. We are enormously excited by this particular campaign. And really the credit for kicking this campaign off goes to Providence St. Joseph Health System, which is based out in the Seattle area. They identified early on both a need for additional personal protective equipment and an opportunity to partner with vendors and others in their community who may be able to provide those. And I think they realized the opportunity that posed nationally as well. And so that's why the AHA took on this campaign to give it a bit of a national footprint. And our goal is to provide resources and a way for those hospitals that need personal protective equipment to sort of link up with those in their communities who may be in a position to help provide it. It's really a facilitation role that we are seeking to play in helping to address what is a vitally important challenge around personal protective equipment.
So Akin, if there's, how do we get involved in this? Is there a place to go on the AHA website where we can contribute, or?
There is. So it'll be very easy to find from our homepage, www.aha.org.
Mm-hmm.
There is a specific part of our website, aha.org/100 million masks, the number 100. Go there, click there. There are resources for hospitals. There are resources for manufacturers. It's a wealth of information for how you can potentially participate in this effort.
All right, last thing for you. I'm going to talk to you about, I want to ask about reimbursement. And I want to ask about specifically the advocacy work that you are doing there, because it's, to me, been very impressive to see, the lobbying that's been going on in terms of just appealing to the different private health insurers, asking for reimbursement, a bump up in reimbursement or reimbursement quicker, faster claims processing, losing the pre-auths, all the stuff that CMS had already said that they would do, and just appealing to those private insurers. And then now, I even saw recently that you're appealing to the federal government to talk about paying for care for the uninsured. So get us up to speed on some of the, I guess, the talking points from your perspective in terms of what you're asking for from the insurers and from the governments in order to speed up the reimbursement for services provided at hospitals to help keep their cash flow going.
Absolutely. So our goal with this, first and foremost, is making sure our heroes on the front lines have the tools, equipment, and resources they need to address this unprecedented pandemic. We have advocated strongly for support for hospitals. Congress has passed 3 different packages over the course of the past month or so. We have specifically asked that as they implement this package that just passed a couple of weeks ago, to provide direct funding to hospitals. We've asked for about $25,000 per bed, $30,000 for those who are in particular hot zones, to really help bolster their resources. The challenge of the financial challenges that this pandemic poses are real. We, in fighting this pandemic, are seeing increases in our costs around equipment, around overtime for staffing. At the same time, we have done things like postpone elective surgeries and other non-urgent procedures, in part to conserve personal protective equipment and make that available. But that also means that one of our key revenue sources is compromised at this point. So that means that the financial challenges hospitals face in the midst of all of this are significant. I would say, first and foremost, what this is all about is making sure that we have the tools and resources that we need to fight this pandemic. And I have heard the analogy, and it's one that I agree with, that this really is somewhat similar to a war in terms of its scale, in terms of its national importance, and in terms of the need for all of us to come together and work together to fight all of it. So for those of you out there who are looking for ways of engaging on this particular issue, advocating with your members of Congress for additional resources to go towards fighting this pandemic for hospitals. And one of the things that all of us can do is implement the recommendations that have come down from the coronavirus task force and from the CDC around social and physical distancing. It is the one thing that all of us can do to make sure that our hospitals have the chance to stay on top of this, to take some of the pressure off of them as we fight this unprecedented pandemic.
Absolutely. And I think, I mean, it's been interesting. I know that hospitals have been fighting some of these challenges in terms of reimbursement, just the number of days that things stay in AR for them in order to get paid. I mean, this has been a challenge that's been ongoing, and I think has been really exposed, along with how overburdened the healthcare system is by this pandemic. So there's a lot of moving parts in all of this, and I want to thank you for your work and the AHA's work in helping, push some of these issues to the forefront, and also for inviting us in the health tech community to join in. I'm sure that you'll get a lot of support as a result of this. So, Akin, thank you so much for your time. It's been a pleasure to speak with you. I'm Jessica DaMassa with WTF Health. Thank you so much for joining us. If you'd like to check out more of these interviews that we've recorded with different healthcare thought leaders about how health technology and innovation and really the healthcare system is just changing so rapidly as a result of the COVID-19 pandemic, please check out my YouTube channel. That's youtube.com/WTF Health. Thanks so much for joining us. We'll see you guys soon.